So my name's Graeme Koelwyn. I'm an assistant professor in the Faculty of Health Science and a principal investigator at the Center for Heart-Lung Innovation at St. Paul's Hospital with Providence Research. So I haven't taught anything with the faculty yet, as I'm a new hire, but my fields of expertise are human pathophysiology, so trying to understand how our body and our systems work both in health and disease, and then also specifically within diseases such as cardiovascular disease, cancer, and lung disease. So my research interests really focus on exercise and particularly how exercise works to protect us from disease. We know a lot about how people who exercise more have lower risk of developing a number of different diseases and chronic diseases, but we don't really know fundamentally how exercise is doing that. And so my work is really trying to understand the mechanisms by which exercise can protect us from disease. So we do that in a number of different ways and a number of different diseases. So we look at cancer particularly, as well as heart and lung diseases. And what we're really interested in is actually how the immune system can be regulated by exercise. And the immune system is a really complex regulatory network within our bodies that helps us communicate between different, or helps our body communicate between tissues, as well as systemically throughout our circulation. And so by understanding how exercise can regulate the immune system, we hope to better understand how exercise can protect from diseases that are related to our immune system and inflammation as well. And really then what that'll allow us to do is start to look at exercise not only as something that's good for everyone to do, but also look at exercise as a potential therapeutic intervention and really start to understand questions like who should be exercising, when should they be exercising, and how much should they be exercising, so that we can use exercise as a way to improve outcomes in patients who are either at risk for certain diseases or from the progression of those diseases if they already have them. So I think it's impacted it on a number of different levels. So as I described, a lot of our research is on the exercise front. We also do some research on what's called multimorbidity. So that's in patients who have possibly more than one condition or disease concurrently. And so this is multimorbidity is something that's really unfortunately growing as we all get older and our treatments for different diseases get better. It means that we are at a higher risk for developing potentially other diseases in addition to the chronic diseases we already have. And so some of our work related to health is starting to understand how different diseases may communicate with each other in the same individual and progress disease. And so we've had some examples of that with heart disease and cancer, where we've shown that cancer patients who develop heart disease actually have an increased risk of progression of their cancer in breast cancer. On the exercise front, we've also used exercise in the acute setting, where we look at how exercise may allow us to unveil early signs of dysfunction or disease. And so in breast cancer patients, we found that using an exercise stress can help us unveil early signs of heart and vascular abnormalities in patients. And we've also looked specifically at how exercise can impact disease pathogenesis itself. So how exercise can actually slow breast cancer or other cancers. And we use model systems as well as studies in patients to try to understand how that works. So for other investigations that we want to explore, there's, the benefit of the position I'm in here at the Center for Heart-Lung Innovation, or HLI, is that it is a translational research center, meaning that there's basic scientists and there's clinicians, there's also epidemiologists that all work together across multiple diseases. So that includes heart disease, lung disease, and critical care disease, as well as some cancer research that we also collaborate with people at BC Cancer as well. But the benefit of being in this center is that we're able to ask questions or tackle research questions that cross diseases. And so one of the great things about being here that I've really benefited from so far, and will continue to, that we hope to expand on, is working with these different clinical research groups to look at how something like exercise could be beneficial across these diseases. So things like critical care disease, people who have come out of the ICU or have sepsis, we're really interested in understanding how exercise may be able to help those patients, as well as, again, patients with lung disease, COPD. There's some really interesting questions where we can apply what we've done in exercise, in cancer, and cardiovascular disease into some of these other disease areas that I think will be really beneficial for patients and people here in BC. as a group, we're inherently multidisciplinary. So we have people who have training in exercise physiology. We have people that have training in basic science, in immunology, in bioinformatics. And what we're really trying to do is to bring a group of people together and students together that are not only going to have expertise in their area, but learn and build expertise across different areas. And so one of the big benefits of our lab, I think, is that we are translational, meaning that we do basic science work, we do model system work, we do patient work, we do population work at the epidemiologic level. We really try to, again, understand how systems work within the body, how exercise can regulate those systems, and then apply that to diseases that are most opportunistic for the types of mechanisms or research understanding that we build. We're really here to be collegial and to enjoy the process of doing research. And so I think what we're trying to do is find questions that excite us, that we think are really impactful, and that can help a lot of people. From a research perspective, is to be able to communicate across disciplines is going to be one of your biggest strengths. Well, so I've really tried to learn across the science continuum or the research continuum from basic science to epidemiology. I'm not an expert really in any of them, but I'm able to communicate across each of those. And then I've also had experience across multiple different diseases. And so what all of that has allowed me now to do as a principal investigator, as an assistant professor, is I can now speak with a lot of different groups and hopefully bring them into some of the questions or some of the research areas that we have interest in, and be able to answer some of these questions that require interdisciplinary expertise. And so, I think getting that advice early for me was really important, where you don't want to necessarily corner yourself or pigeonhole yourself in one area. If you can give yourself expertise or be able to speak across multiple areas, it will expand the ability for your science to be impactful and be able to answer questions that may not have been able to be answered if you had focused on one specific component.